Hello. In the previous video, we looked at the pathway blood takes from ascending aorta to the organs in the GI tract. In this video, we're going to look at the basic anatomy of a normal ECG, which is electrocardiogram. Below, I've drawn a normal ECG, which looks something like this. It is represented in the box. ECG is basically composed of three main parts: the P wave, the QRS complex, and the T wave. P wave is represented in light green color, QRS complex represented in blue color, and then T wave represented in purple color. Now these parts of the ECG mean something, so let's look at them. Let's look at the first part, which is the P wave. Now during the P wave, basically atrial depolarization happens. Now P wave initiates atrial contraction as well, but it doesn't take place in the P wave or during the P wave. So P wave, the main thing that takes place during the P wave would be atrial depolarization. So the electrical impulse, which is basically initiated from the right atrium, passes to the left atrium, and they both depolarize. And you can see the picture below. In this picture, you can see that the electrical impulse is being initiated from the right atrium, and then it passes to the left atrium, and in that case, both atriums depolarize. Now, as I said earlier, that P wave initiates atrial contraction, and that basically happens between the P wave and the Q segment, or the segment between P and Q. So that is when atrial contraction happens. Atrial contraction is also called atrial systole. Now let's look at QRS complex. QRS complex represents two main things. First of all, it represents ventricular depolarization. So the electrical impulse, once it passes from the atrium to the bundle of His, then it goes to the Purkinje fibers and it basically depolarizes the ventricles. So the first thing that takes place is ventricular depolarization. The other main thing that takes place during the QRS complex, which in a way is hidden in the QRS complex or during the QRS complex, is atrial repolarization. So in the P wave, atrial depolarization takes place, and between the P and QRS complex, atrial contraction takes place. Now, since the ventricular depolarization is taking place, the atrial, after its contraction, have to repolarize to relax later on. So atrial repolarization also takes place during the QRS complex. Similar to P wave, QRS complex also initiates ventricular contraction, which happens between the QRS and the T wave. So you can say it happens between the S and T, or the segment outlined here. So between S and T, ventricular contraction takes place. Ventricular contraction is basically the systole of the ventricles. And QRS complex is also shown in this picture, highlighted. You can see that the electrical impulse passes through the bundle of His and then the Purkinje fibers of the ventricles. Now the last wave, or the last part in the ECG, is T wave. Two things happen during the T wave. The first thing that happens in the T wave is ventricular repolarization, which initiates from the apex of the heart. And the next thing that happens during the T wave is that it initiates ventricular relaxation, which happens after the T wave. So you can say after the T wave, ventricular relaxation takes place. And you can see in this picture that ventricular repolarization is taking place from the apex of the heart. At the end, I just want to give credit to the developers of this picture who made this picture possible. I directly took this picture from the link cited below. That is all for today. This video, we looked at the basic anatomy of a normal ECG. If you want to check my other videos on heart anatomy, blood flow through the heart, blood flow to upper extremities, lower extremities, or even the GI tract, as we have seen in the previous video, feel free to check out my channel and like and subscribe. Thank you very much.